What are the long-term effects of taking nicotinamide riboside? Have you ever wondered about the long-term effects of taking nicotinamide riboside? This compound, a form of vitamin B3, plays a vital role in our cells. It helps produce nicotinamide adenine dinucleotide, or NAD+, which is essential for energy metabolism and mitochondrial function. As we age, NAD+ levels decline, and this decline is linked to neurodegenerative diseases like Parkinson's disease. Researchers are exploring whether nicotinamide riboside can boost NAD+ levels, improve mitochondrial health, and reduce inflammation, all of which are important in managing Parkinson's disease. Current understanding of the long-term effects of nicotinamide riboside is still developing. Some early clinical studies indicate that nicotinamide riboside is generally well tolerated and can significantly increase NAD+ levels in the brain. These studies have also noted reductions in brain inflammation, a key feature of Parkinson's disease. Due to these promising results, larger clinical trials are currently underway to assess the long-term safety and effectiveness of nicotinamide riboside in Parkinson's patients over extended periods, such as 1 year or more. However, we still await comprehensive long-term data specifically in this patient population. When it comes to safety, typical doses of nicotinamide riboside, usually between 500 to 1,000 milligrams per day, are considered safe with minimal side effects reported in short to medium-term use. However, high doses or prolonged use of nicotinamide-related compounds may carry risks. Some studies suggest potential epigenetic changes, which can affect gene expression and DNA integrity. There are also concerns about possible adverse effects from long-term high-dose intake, such as headaches, dizziness, and nausea, although these are more commonly associated with nicotinamide rather than nicotinamide riboside itself. Interestingly, emerging research has raised questions about cancer risks associated with high levels of nicotinamide riboside. Some studies suggest that it might increase the risk of certain cancers, such as triple-negative breast cancer, and could promote metastasis in specific contexts. This finding adds complexity to the discussion, highlighting the need for careful evaluation, especially for Parkinson's patients with a personal or family history of cancer. Additionally, research has shown that while nicotinamide riboside may initially alleviate symptoms in experimental models of Parkinson's disease, it may later downregulate dopamine metabolism. Since dopamine deficiency is a hallmark of Parkinson's disease, this suggests that while nicotinamide riboside might provide short-term relief, its long-term impact on dopamine pathways needs careful study to avoid unintended effects on disease progression. In summary, nicotinamide riboside shows promise as a neuroprotective agent by boosting NAD+ levels, enhancing mitochondrial function, and reducing inflammation, key factors in Parkinson's disease. However, long-term safety data are still emerging. While short-term use appears safe and well-tolerated, potential risks such as epigenetic changes, effects on dopamine metabolism, and cancer risk requiring further investigation. If you have Parkinson's disease and are considering nicotinamide riboside supplementation, it is essential to consult your healthcare provider. They can help you weigh the potential benefits against the risks based on your individual health profile. Nicotinamide riboside should not replace established Parkinson's treatments but may serve as a possible adjunct under medical supervision. Ongoing and future clinical trials will provide more definitive evidence on the long-term effects of nicotinamide riboside in Parkinson's disease and help guide safe therapeutic use.